Welcome back to the Medical Store channel, where we share medical related videos. This is part 3 of our series about the thyroid gland and its disorders and the hormones that it produces. So today we are looking at hyperthyroidism, okay? So if you are new to this channel, you need to know that this is actually part 3. We have already made videos about the thyroid gland, its anatomy and its effect and its hormones, and the effects of the hormones that it releases. And therefore today we are diving into the disorders, okay? The disorders of the thyroid gland. And the first one that we are going to look at is what we have referred to as hyperthyroidism. So let's review a little bit of the physiology of the thyroid gland so that we can understand when we reach hyperthyroidism. Now, we said that the thyroid gland is located just below your larynx, okay? Or what we sometimes call the Adam's apple. And it has two lobes. It has the right and the left lobe, and they are connected by what we call the isthmus, okay? And it produces hormones that we call T4 and T3 hormones. But don't forget that T3 is the most active hormone among the hormones produced by the what? By the thyroid gland. And therefore we find that the body always converts T4 to T3, which is the active component, or which is the active hormone of the thyroid gland. Now, the effects of these hormones include, one, on the cells. We said that these hormones are responsible to increase glycolysis, okay? These hormones are also responsible to increase lipolysis. And therefore, of course, as you increase glycolysis, as you increase lipolysis, as you increase glycogenolysis, you are increasing what we call the metabolic rate, okay? And also on the heart, we say that these hormones are responsible to increase the heart rate and also the force of contraction, okay? When we look at the digestive system, we say that these hormones are also responsible to increase motility. On the nervous system, we said these are the hormones that help you to remain oriented, okay? Oriented. And they increase what we call mentation. And on the skin, these hormones are responsible to increase blood flow. And of course, as you increase the blood flow, this will result in increase in growth of hair, okay, on the skin. And then bones, they are responsible to cause maculation and growth of the bones, okay? And belief about regulation, we know that the hypothalamus, okay, produces what we call the thyroid releasing hormone, or what we always refer to as TRH. This TRH goes to the pituitary gland, okay, and instructs what we call the thyrotropes. The thyrotropes are cells that are located in the anterior pituitary gland that produces what we call TSH, thyroid stimulating hormone. And therefore this thyroid stimulating hormone is the one that comes to the thyroid gland and ensures that the thyroid gland produces our T4 and T3, okay? So with that in mind, or with that at the back of our mind, let us now come directly to what we call the hyperthyroidism. Now, what is hyperthyroidism in this case? Hyperthyroidism is a condition whereby we have increased amounts of thyroid hormones, okay? For some reason, the thyroid gland produces a lot of these hormones in larger quantities. And so we are going to look at the causes, what causes it. We are going to look at the presentation, or what we call the signs and symptoms. How can we diagnose, and then we shall look at how can we treat a person with hyperthyroidism. Now, These causes are graded in two categories. We have what we call the primary causes, and we also have what we call the secondary causes. Among the primary causes, the most common is what we call Graves' disease. You can forget other things, but don't forget Graves' disease. Now, what is this Graves' disease? Graves' disease is a condition whereby it is an autoimmune disease whereby the body produces antibodies, okay, that affect the thyroid gland. It produces antibodies that we call TSI, thyroid stimulating immunoglobulins. So these thyroid stimulating immunoglobulins go to the thyroid gland and then in the thyroid gland they act as the thyroid stimulating hormone. In other words, they go to the receptor of the thyroid stimulating hormone, okay, and stimulate these receptors. And therefore, the thyroid gland is going to produce a lot of hormones because it's as if it is being stimulated by TSH. Okay? I hope that is clear. Yes, the second one, which is a primary cause, is what we call the toxic adenoma. Now, what does this mean? This means that the thyroid gland itself is having a tumor which makes it produce a lot of hormones, okay? So it has a single tumor on one of its lobes, and this encourages it, or this makes it produce a lot of T3 and T4. Another cause, which is also a primary cause, is what we call toxic multinodular adenoma. Okay? You'll find it abbreviated as TMA. Toxic multinodular adenoma. What does this mean? Basically, it means that we are having more than one tumors in the thyroid gland, and therefore, as a result, they also lead to increased production of the hormones of the thyroid gland. So, a quick review. Primary causes are the causes that are actually affecting the thyroid gland itself. Okay? The problems are around the thyroid gland itself. So we are saying we are having a Graves' disease whereby we are having autoimmune antibodies that stimulate the thyroid gland. The second one, we are saying we are having what we call toxic adenoma, a tumor. And the third one, we are having toxic multinodular adenomas, which are many tumors on the thyroid gland. Now, let's look at the secondary causes, okay? Secondary basically means that the problem is not the thyroid gland, but the problem is somewhere else. It could be the hypothalamus, or it could be the anterior pituitary gland. So this problem, when it is somewhere else, not the thyroid gland, those are the ones that we call secondary causes. Now the first one is what we call a pituitary adenoma. Now, a pituitary adenoma basically means that the pituitary gland, okay, is having a tumor, and as a result, it is going to lead production of increased amounts of TSH. This increased amount of TSH will automatically come and stimulate the thyroid gland, and the thyroid gland will also produce increased amounts of T3 and T4. So as a result, someone will also get hyperthyroidism. Now, there are some other causes that are not really very common. There are causes whereby you have damage to the thyroid gland. The reason I'm bringing this at the end is that normally this causes what we call a transient hyperthyroidism. In cases whereby the thyroid gland has been damaged, for example, in an accident or trauma, it releases a lot of its hormones, because the hormones are always kept in the follicles, okay? These follicles. So these hormones are released at once in blood, and as a result you get a hyperthyroidism which is transient. It is for a very short period of time and it wanes off, okay? And another cause which is really not common is what we call when there is an increase in the amount of beta HCG, okay? So this normally is as a result of when someone has something like molar pregnancy, okay, or what we call a choriocarcinoma. So, but these are really not very common causes. Now that we have understood the causes of hyperthyroidism, let's look at the signs and symptoms or the presentation. If someone has hyperthyroidism, how will they present? How can you look at someone and be able to tell that someone is having hyperthyroidism? Okay, so this is very important if you understood the effects of thyroid hormones. Why am I saying that? Because what will happen here is that there is going to be amplification of the effects of thyroid hormones, okay? So that is why we did a review here. So let's come back and make a comparison, okay? So we said that the thyroid hormones are responsible to increase glycolysis, are responsible to increase lipolysis, and therefore increase in the metabolic rate. So meaning, if we are having a very high increase, okay, in these hormones, here on the cells, we are going to have a very high increase in metabolic rate. And what does this translate to? Increase in high metabolic rate leads increase in glycolysis, increase in lipolysis, increase in glycogenolysis. And therefore, as a result, okay, we are going to have an increase in body temperature, because an increase in a metabolic rate results in an increase in temperature. And therefore, someone will have an increase in temperature. And this person can also become heat intolerant, okay? Someone cannot tolerate heat because already is producing a lot of heat. Another thing is that this increase in lipolysis and glycogenolysis is going to lead to a decrease in weight. Okay, so someone is going to lose weight, someone is going to be heat intolerant. And also here on the heart, we say that they are responsible to increase the heart rate and the force of contraction. So meaning when comes this person with hyperthyroidism is going to have an increase in heart rate, okay? And this can actually lead to what we call tachycardia. Okay? So someone is going to have a tachycardia. And we are going to look at if this becomes worse, someone can actually even get what we call arrhythmias. And then also, we say that they are responsible to increase the force of contraction. So increase in force of contraction leads to increase in what we call the stroke volume. Okay? And this also leads to increase in cardiac output. And as a result, this person can become hypertensive. You'll find that the blood pressure of someone with hyperthyroidism are more likely to go up. Digestive system, I want to find that because it increases motility, meaning someone is going to have diarrhea. Why? Because when you reduce the time that food takes in the digestive system, you have reduced the time of absorption of the water, and therefore meaning someone is going to easily pass stool that has not been concentrated, and therefore that increase in motility is going to lead to increase or to diarrhea. Now, nervous system. we need to understand, in our first video, we found out that these hormones increase the effects of what we call the sympathetic nervous system in general. Okay? So, it means that one, this person is going to be easily agitated. Okay? Two, this person is always tired, but is also having what we call insomnia, or what we call failure to sleep. You feel tired, but then you cannot sleep. And if it becomes worse, someone can even become confused, okay? Confused. Also, we said that these hormones have an effect on the bones, and then for someone who has hyperthyroidism, shall find that they will have an increase in bone growth. But the problem is that there's an increase in bone growth and they mature very quickly, and therefore what we call the epiphyseal plates close early. Okay? They close early. So most of the time someone doesn't become really a giant as we would expect in this case. But also, you know that there are other hormones that, like growth hormone, that also control growth of the person. That's why we don't have a very significant change in bone growth and maturation in hyperthyroidism. Then lastly, on the skin, we say that it increases blood flow to the skin, and therefore we have increase in hair growth. Okay? But also we have an increase, because when you increase blood flow, you are going to also increase the production of sweat, and also the sebaceous glands are going to become active. So you find someone has an oily skin, and therefore even the hair grows very fast, but also is what we call saboto, is hard. Okay? Someone has hard hair. Now, these are classic symptoms or classic signs and symptoms of hyperthyroidism. Something that I need to clarify is with Graves' disease. Now, Graves' disease has its own classical presentation. There's what we call oxothalamus. Okay? And what we call a buffalo oxothalamus. Let me first explain this. Now, what happens in people with Graves' disease is that you find that the eyes are actually protruding. Why is that the case? I will explain a lot more really in a video that I will do about Graves' disease. But in brief, we have what we call glycans behind the eyeball. So, with Graves' disease, these TSI that we have talked about, they go into these glycans and they attract water. So you find there is accumulation of water in what we call the retroorbital areas, and then someone has exothalamus, or the eye is actually protruding. All right, now that we have understood this, let's look at diagnosis. How do we diagnose someone with hyperthyroidism? Okay, now, in this case, normally we are going to start with what we call the thyroid functioning test. Thyroid functioning tests actually look at free T4 hormones and TSH. So it will tell us if someone has an increase in free T4 and an increase in TSH. Why is this important? We say that these causes, we have what we call primary causes and secondary causes. In someone who has a primary cause, like Graves' disease, like toxic adenoma, like a damage to the thyroid gland, you will find that T4, okay, free T4 is high, okay? But because of what we call the negative feedback, when you have increased T4 in blood, this information is going to go back to the hypothalamus, to the pituitary gland, and tells it, look, there is a lot of thyroid hormones in blood. So what you do, reduce the production of TSH. And therefore, you'll find that you have low TSH. Let me repeat this once again. I'm saying this helps us identify if it is a primary cause or if it is a secondary cause. How? In primary causes, we said the problem is with the thyroid gland. And therefore, someone with a problem with the thyroid gland, these people are going to produce a lot of free T4 hormone. This T4, because of what we call the negative feedback, the information is going to go back, okay? You have a lot of T4 in blood. This information will go back to the pituitary, okay, and tell it to reduce the production of TSH. And therefore, you will have low TSH in blood, but high free T4, okay? Now, if it is a secondary problem, okay, if, for example, the problem was with the thyroid gland, if it is with the pituitary gland, it means that, like you have pituitary adenoma, you are going to have high TSH and high free T4. Because the pituitary is producing a lot of TSH, this TSH is going to the thyroid gland and causing it to release increased amount of T4. And therefore, you're going to have all of them increased. Then, so this can help you to differentiate. This is in cases of secondary causes. Then also, if it is, you find out it is a secondary cause, you can do an MRI, and this can help you to locate where there is an adenoma. Also, you can do an ultrasound scan. This is in cases of where we looked at beta HCG in cases of where someone has a molar pregnancy or maybe a choriocarcinoma. An ultrasound scan can help you to rule out. All right. So now, guys, that you have followed through up to this point, let's look at what we call, or how do we treat these people with hyperthyroidism, okay? Now, we have some drugs that we can use, or what we call the medical management, but also we have surgery in some cases. We normally use what we call beta blockers, and specifically in this case, we use propranolol. Why do we like propranolol? We normally use propranolol because if you remember in the production of thyroid hormones, there is where we have conversion, okay, of T4 to T3. Okay? We have this conversion in the body because this is the active ingredient. So what propranolol does is that it blocks the enzyme that is responsible to convert T4 to T3, what we call a deiodinase enzyme. And therefore, you will not have the effects of the thyroid hormones. Then we also have what we call methimazole. Methimazole is one of the most liked drugs of hyperthyroidism, but it is not used in what we call pregnant women in first trimester of pregnancy. This is the only indication of methimazole, but otherwise it is a drug and one of the most liked drugs. And also the way it acts is that it performs the same way like our propranolol. It also prevents the conversion of T4 to T3. Then we also have what we call propylthiouracil. Now, propylthiouracil works in the same way, but also in addition to that, it also prevents, during also the production of these hormones, there is where we have an enzyme that we call TPO that helps in adding our thyroglobulin plus iodine, okay, so that you can have your hormones T3 and T4. So what propylthiouracil does is that it blocks this enzyme, and therefore you do not have this iodination taking place, okay? And also in addition to that, it can also work in the same way as these other two drugs that we have looked at. And then we also have what we call radioactive iodine. Sometimes it is also used. So radioactive iodine, basically what it does is that when it is taken, this iodine is trapped by the thyroid gland, okay? But when it reaches in the thyroid gland, it produces radiations that start to destroy the thyroid gland, and therefore it reduces the amounts of hormones that it produces. Lastly, surgery. Surgery can be, they can cut out one lobe of the thyroid gland, in this case what we call lobectomy, or they can cut out the whole thyroid gland depending on what is the cause. So guys, thank you very much for watching. If you've reached at this point, please consider subscribing, consider sharing, consider giving us a like so that you are always notified by every time that we upload a video. Thank you very much.